As COVID-19 coronavirus infection continues to spread across the country, recent data has shown that Native American communities, particularly in the Southwest, are often very hard hit by the virus. Contributing factors may include high rates of poverty and chronic disease, lack of critical infrastructure like running water, isolation from health resources, crowded and multi-generational living conditions, and close-knit community support systems. Despite many of these communities being located in rural areas, the low population density has not had a protective effect against infection like we have seen elsewhere in the country. The COVID-19 fatality rate, meaning the percentage of people who test positive who have died, in the state of Arizona is 1.8%, whereas in Navajo Nation, which is located primarily in Arizona as well as the other Four Corners states, it is 4.5%. Looking at county comparisons on the COVID-19 Health Equity Dashboard, we can find some clear visual representations of higher COVID-19 case and death rates in Native Americans in the Southwest. To start visualizing, click on the tab Map Your State. By selecting a state and next selecting deaths or cases under COVID outcomes, and finally selecting percent Native American in county population characteristics, you can map side by side these relationships in a state of your choosing. As we see here, deaths per 100,000 in Arizona track with the Native American population. So does poverty, diabetes, and socioeconomic vulnerability. Cases per 100,000 track with obesity and minority/language vulnerability. Next door in New Mexico, we see a similar pattern, although the case and death rate is overall lower. Deaths per 100,000 tracks with the Native American population, as does diabetes. Lack of insurance tracks with cases per 100,000. Two recent articles in the New England Journal of Medicine explore this issue. The first is Rural Matters, Coronavirus and the Navajo Nation. The second is Contact Tracing for Native Americans in Rural Arizona. We encourage you to read more and think about the systemic issues that are leading to severe COVID-19 outcomes in Southwestern Native American communities.